Welcome to 10 effective mobile consumer engagement tips brought to you by iTriage. This Mobile Tips ebook will help you understand how mobile consumer engagement attracts new patients, improves patient satisfaction, improves patient engagement and helps achieve meaningful use too, increases patient retention, improves clinical outcomes, and helps reduce costs. Improving patient engagement may be at the top of your to-do list in 2013, especially as it directly relates to achieving meaningful use requirements and maximizing reimbursements. But what about consumer engagement? Is that a key initiative? Are you building a strong consumer engagement strategy? If not, you should be. Consumer engagement impacts patient engagement and patient satisfaction. And that strategy should also include mobile technology, such as smartphones and tablets, to help you reach consumers through the convenient tools they use most often. So why does consumer engagement really matter? Let's review. Consumers are avoiding care, which will impact healthcare costs and future patient outcomes. Consumers are avoiding care due to high costs, with 25% of consumers surveyed in a Deloitte poll saying they decided not to see a doctor when sick or injured, and 19% having delayed or even skipped treatment recommended by a doctor. It's also important to recognize that patients are consumers, and they want more convenience and control. Despite providers referring to people as their patients after single treatment, those same people view themselves differently. They see themselves as consumers of healthcare with the right to be in more control of their healthcare management. Consumers want the flexibility to consult multiple referral sources and choose their own care providers at every stage of the care continuum. And that won't always result in their staying within your health system for follow-up appointments. However, strategic consumer engagement before, during, and after they become your patient can influence consumer choice and help you steer and retain people in your health system. In addition, consumer engagement helps achieve meaningful use too, improve patient satisfaction and engagement. Achieving MU2 requires that patients really use the patient engagement technology tools. To achieve MU2, it helps to think about patients as consumers who want convenience and control when engaging in the management of their health care. Using this lens, you can begin to incorporate engagement tools that people can easily and conveniently access. The result will be more engaged and more satisfied patients. Now let's talk about mobile. Why does mobile matter? There's a lot of research now about consumers using the internet and mobile tools to access health information, research healthcare providers, and make appointments with physicians, as well as about the increase in consumers of all ages and income levels using cell phones, particularly smartphones, to access the internet. So mobile web is increasing. There are a lot of stats out there. These are just a few of them to show why mobile matters. So now we invite you to check out the 10 top mobile consumer engagement tips. These effective tips on using mobile technology help you inform, attract, engage, and retain consumers and patients. By following these tips, you'll reach your end goals of improving patient satisfaction, lowering the cost of health care, attracting more appropriate and commercially insured patients to your facility, booking more appointments for your physicians, and continually converting consumers to patients throughout the care continuum. Tip number 1 falls in the inform bucket. Help consumers make better healthcare decisions. The most simple and useful tool you can provide consumers is a mobile symptom checker, and one that includes information about possible medications, procedures, and treatments is even better. While you may not want people self-diagnosing, you do need to face the fact that people are looking up health information on their own. So help them by providing them with credible, informational tools that can help them figure out what might be wrong and possible treatment options so they can be better informed when they decide which health provider to visit. Tip number 2, Build trust and improve patient satisfaction. Help consumers determine appropriate care providers and costs. Symptom checkers are great, but you can increase consumer engagement, build trust among prospective patients, and ultimately improve patient satisfaction by helping people connect the dots between possible medical conditions and appropriate care providers, as well as offering information about potential costs for treatment. This additional layer of unbiased decision support helps consumers take action at the point of medical need, and along the way, you can also help reduce the costs of healthcare. The best symptom-to-provider pathway tools help consumers view and compare a mix of emergency, urgent, and non-urgent provider care options that are appropriate choices for their selected medical condition. Healthcare provider options might include ERs, physicians, urgent cares, retail clinics, pharmacies, and outpatient clinics. Tip number 3 falls in the attract bucket. Help consumers find you at the point of medical need. When consumers use mobile technology to seek information, they are more likely to quickly take action on that information as often as within the same hour, such as visit an emergency room or urgent care, schedule an appointment with a physician. You need to make sure that they can easily find you. If your organization has the resources, you may opt to build your own mobile app that offers facility and provider listings. However, since these consumers are not yet your patients, you'll only reach a limited universe of folks who already know you and look for you and your providers by name. In order to help people find you and engage with them when they're actively looking for care, consider partnering with a third-party consumer mobile app that has far greater reach. Tip number 4, stand out from the crowd. Inclusion in a credible, popular mobile app is a great start. In order to stand out from the crowd, however, you need more than a simple listing among hundreds of other care providers. You need to deeply engage consumers when they're actively looking for care. And the more information you can provide about your facility and physicians, the better you will be able to compete against competitors. The more information you include, the better decision support you provide for consumers. You'll also want to provide more engaging information that supports your brand and allows consumers to take action on the information, such as directly linking to your website, social media assets, watching facility videos, and even appointment booking tools. Tip number 5, draw commercially insured patients. The very fact that you will engage consumers via smartphones and tablets will naturally draw more tech-savvy consumers. And market information shows that consumers who connect with providers via mobile apps tend to have a better payer mix. In addition, the more decision support tools around symptoms, procedures, treatments, provider options, costs, and even health plans accepted, the more you'll be able to help consumers self-select options that are appropriate for their insured status. Tip number 6 is in the connect bucket. Make it easy to connect when consumers are selecting their providers. Because people who seek information using mobile are more likely to quickly take action on that information, it's critical to make it easy for them to connect with you using that same mobile technology. Simple, convenient, 24/7 accessible tools will improve patient satisfaction and drive patient traffic to your facility or to your physicians. The most common and easiest to implement mobile apps on the market are physician appointment booking and even ER check-in services. Other simple mobile app connectivity tools include direct dialing and GPS mapping to help people easily reach you. Tip number 7, leverage your physicians. Here's a tip that's less intuitive, but potentially very powerful. Involve your employed and affiliated physicians in the community to extend consumer engagement, improve patient satisfaction, and increase patient traffic to your ER. Let's say you've decided to use a mobile app to let consumers check into your ER prior to their arrival. That's great for people who are heading there on their own. But what about people who are referred to your ER directly from a physician's office? You can educate those physicians to tell their patients about your mobile ER check-in service and recommend that they use it to notify you of their pending visit to your ER. Tip number 8, give them everyday health management tools. The more healthcare management tools in a single location, the better. There are thousands of health management apps in the market, but research shows that mobile apps often have retention rates as low as 3%. The more useful tools you can offer in a single app, the more likely people will be to use it and keep it. And you can create more stickiness with consumers and existing patients via your own brand. You'll also be thought of as a useful resource even when the consumer isn't looking for immediate medical care. Some of the most useful and popular health management tools, in addition to the symptom checker, include medication reminders, appointment scheduling tools, customized health news, fitness, and weight loss apps. Tip number 9 falls in the retain bucket. Steer patients back into the system. As we mentioned, people don't necessarily view themselves as your patients after just a single hospital visit. Rather, they see themselves as ongoing consumers of healthcare with the right to choose their own providers at every stage of the care continuum. Mobile technology can help you quickly steer consumers back into your health system before they've even left your facility, and you get to convert them back into patients. Let's say a person needs follow-up outpatient care after leaving your ER. There is new mobile brokered appointment setting tools in the market that enable your ER discharge team to schedule follow-up appointments on behalf of the patients or consumers with your health system's providers at the time of discharge. Tip number 10, improve meaningful use 2. Meaningful use 2 requirements include giving patients access to their medical health records. But many consumers use different physicians and hospitals from different health systems. For them, it may still be quite inconvenient to review all of their personal health info and clinical record info in a single location. Mobile technology can help you increase consumer and patient engagement, stickiness, and loyalty by providing easy access to your patient portal as well as to third-party PHRs like Microsoft Health Vault. The key is to provide access to all health information from a single mobile app to deliver the convenience that consumers desire. That's it. Thank you for listening to the 10 effective mobile consumer engagement tips brought to you by iTriage. We invite you to kickstart your mobile consumer engagement plan today by visiting us on our website or calling us at 877-498-2216.